I think the conversation is actually more important to the outcome than anything else that you do in the visit. It is challenging when you have very little time in a patient visit to engage in a lot of conversation. The way I think about it is that everything else we do in the visit is really, in some ways, kind of a waste of time. I mean, we do need to find out if people have diabetic neuropathy, but we don't have to obsessively do it at every visit. You know, we do need to look over glucose logs, but that's not the only thing. So for me, it's not about coming up with a great note, it's about coming up with a great conversation. I think it's really important to not only ask relatively open-ended questions like, how are you doing? Are you having any problems with your diabetes? I think it's even more important to take the time to actually listen to patients. I think often what happens is, you know, as a provider or in any walk of life, you throw these throwaway questions out there. Then you don't even really listen to what people say in response to it because you're at the same time, you know, trying to enter data into your electronic health record and the like. At the end of the day, you know, these realities of billing and documentation consume a lot of our time, but the truth of the matter is they don't really have to. I love it whenever a patient asks me a question because it creates an opportunity for shared decision making around their therapy. The most important thing is to listen for what it is that the patient is concerned about. I try and be very quick in the assessments that I feel, you know, really need to be made at every visit. You know, checking the blood pressure, seeing if the weight is up or down, reviewing the medications and side effects. But at the end of the day, it's the conversation that you have that makes the difference in the care of the patient. And frankly, that's why diabetes educators are so valuable, is because they're going to have a 30-minute or 1-hour conversation where you're going to have a 5 or 10-minute conversation. But the conversation is key. The rest of it is bookkeeping.